fourth speaker is Dr. Yuhong, come from England. No, stop. Dr. You still yes. Okay. Dr. Xie, so today give us that topic is case study of pain relief of qi needle Dao-yin therapy. It's very new technique. So let me introduce briefly Dr. Xie. Dr. Xie got a PhD in Chinese acupuncture from Nanjing University. He is a founder of Qi Needle Dao-yin therapy. He is a professor and supervisor for PhD student and at Victoria College in the UK. That Victoria College in the UK is affiliated to Nanjing University of Chinese Medicine in China. Dr. Xie is a president of the International Tai Qigong Health Association, and currently Dr. Xie is a member of the academic committee of the Association of ATCM. Very brilliant. Okay, warmly welcome Dr. Xie. Your knowledge. Thank you very much. Please.
Hello. Hello, dear experts and friends. First of all, I would like to thank Dr. Hui for her invitation and all the friends of the conference team for their hard work. It's a great honor for me to participate in the International Conference on TCM and PAN in 2021, which gave me the opportunity to learn from all the experts and friends attending the conference. I wish the conference a complete success. I would like to introduce it from the following three aspects. My topic is case study of pain relief by Qi needle Dao-yin therapy. The first one is what is Qi needle Dao-yin therapy? The second one is the case study. The third is the principle and the teaching extension of Qi needle Dao-yin therapy. This picture shows the 2019 when I taught Qi needle Dao-yin therapy in St. Paul, Brazil. Lots of local the acupuncture practitioner and the natural therapist come from the Brazil, Argentina, Chile. My Qigong experience, I started to practice since 1985 when I studied acupuncture, Chinese medicine in Nanjing University of TCM. I began to practice Qigong. And my first Qigong is Shaolin Inner Strength One Finger Meditation Zen, meditation Qigong. When I graduated from uni in 1990, I was very lucky to work in Jiangsu Qigong Scientific association for 2 years. And this picture, this is me 30 years ago. About 30 years ago. I practiced the Shaolin Qigong, Ma Bu Zhan Zhuang, and the Jingji Duli Golden Chicken Independent Pair. This picture, he is my my tutor, Professor Yutang Li, my tutor for the doctor degree, the acupuncture. That he supported my Qi acupuncture very much. During last 16 years since I came to the UK, I have still applied the traditional Chinese medicine Qigong technology combined with acupuncture and massage in clinical practice, especially in the treatment of pain, and organize the patients to practice Qigong. This picture is my first patient when I worked in UK Somerset area, Western Shumer, the clinic. I just use the external Qi to treat for this guy. And later I had a short video show you. I have been teaching overseas students since 1994. Yeah, in the middle of this picture is when I went to Indonesia, Jakarta. Here is Bali. Bali Island is a very beautiful place. Teach Qigong. Yeah, this picture is when I teach in Nanjing University of ATCM. Lots of students, they come from Germany, from Hamburg. Yeah, this is my first group of foreign students to study with me. In addition to treating pain, I also use Qi acupuncture to treat many difficult conditions, such as cerebral palsy. Yeah, this is the little boy, just 3 years. Paralygia, yeah, this girl, just 5 years old. And scoliosis, yeah, this boy, 12 years old, come from Germany. So when I do the Qigong, I always combine with the acupuncture, needle, and the tuina, and the stretch. And sometimes I use the Qigong, yeah, for the pulse diagnosis together with the Qi. Here, there is a very short the recording. Yeah, maybe I play this. Maybe it's more clear than my language, than my English.
Dr. Xie, PhD and medical doctor, is the first to summarize the combined TCM therapy of Qi, needle, and Daoyin. Based on his clinical experience for over 20 years. Qi needles consist of Qi Zhi Zhen, using finger with Qi as needle, Qi Hao Zhen, Qi on normal acupuncture needle, and Qi Fu Zhen, Qi on special needle. This unique clinical treatment method uses external Qigong healing in acupuncture and tuina, Chinese medical massage. The effects are provable. Dao Yin, guiding energy, means the doctor or practitioner emits Qi onto the affected area to promote the patient's Qi and blood circulation, and also guides the patient to practice specific medical Qigong exercise, which assists in identifying and healing diseases.
Here, lots of pictures showed you. I over 30 years. I do the Wei Qi, just to give Qi, give energy, emit Qi for the patient, and do lots of treatment. Not only just for the pain problem, for many problems. So I use the Qi. I can control the patient's the arms, the legs to move. The students come from Korea. Now here, there are two short videos. This is just, I said, that guy I did treatment for his arm, shoulder. And this video I play for you. This is not for treatment. This just about 2001. I taught in Nanjing University of ATCM. This student, there are lots of students from Taiwan, but this guy, he don't believe Qigong. So after that, the group, every student from Taiwan, they believe the Qigong. Yeah, I play this video. This is 2004. I worked in my first patient. This guy, he's a martial arts tutor. His arm injured by the teaching his student. That time he come to my clinic. He said, "Dr. Xie, my shoulder is very painful, can't move. And can you do the quick treatment to help me tonight? I have 40 students. I will teach them for the tonight lesson." So I say I try, but it's very, very good. After one time treatment, just a few minutes, he can move. And he said, "Oh, Dr. Xie, I will learn Qigong with you." So since that time to now, every year, he always keep relaxation. He sent lots of students to my clinic to do treatment and study the Qigong with me. So what he's doing conducting qi or guiding energy. Conducting qi, also called directing qi, is based on the foundation of training qi to further direct qi to the emitting location, hand forms, acupoints. Through the exercise of maneuvers of conducting qi, achieve the accomplishment that it arrives simultaneously with the arrival of mind will, and enable one to control and sense the location, direction, pattern, and quality of the flow of internal qi, nei qi, as well as the quality of qi, thereby laying a solid foundation for the exercise of the manipulations to emit qi. Here's the picture. We have 3 dantian, the upper dantian, middle dantian, lower dantian. The Qigong acupuncture physicians should pay attention to the cultivation and transportation of dantian qi. The dantian is the source of life and a place where vital energy gather and disperse. When trained, the qi mound or qi mass is formed in the area of dantian under the control of subjective consciousness with breath and the driving force and the meridians at the channel. The vital energy in the body can freely gather and disperse, and it can flow a certain meridian circulate to run, establish a condition relax, and form a relation between the brain and the certain part of the certain acupoint, so that the Qigong doctors can release the energy of external qi, Wei qi, to the patient when treating the disease. I have 10 minutes left. I will go quickly. 古今中医大家们十分推崇气功与针灸的结合。The combination of Qigong and acupuncture is highly respected by TCM practitioners in ancient and modern times. For example, the following the list here, 10 TCM acupuncture masters in modern China, including national level masters. For example, the Chen Dai'an, 郑奎山、彭敬山、侯朴仁、邓体涛、张天戈、庞鹤鸣、刘天军、张文春。So here I just introduced the first one, Chen Dai'an. Chen Dai'an is the first president of Nanjing University of TCM. He paid special attention to Qigong training. All the acupuncture classes he held was specially designed to practice Qigong. When Mr. Dan Chen acupunctures, the needle arrives, the mind focuses, the qi arrives, and the disease goes away. 我们说真道、医道、气道并即去。He believed that the main body of the needle effect has 3 main points. The first is the spiritual induction. The second is the mental concentration. The third is the physical stimulation. With the coordination of the 3, the great achievements are made. If we want to improve the therapeutic effect of acupuncture, it's necessary to practice qi. Chen Dai'an, his method of qi training is very simple. Just if every day you practice 3-5 minutes or 10 minutes to the meditation training, for example, do the qi breathing, breath out with tummy. Do the deep breathing, breath out with tummy. Every day practice this. The dantian qi, lower dantian qi will be improved. And my simple method is to train the horse. That is the train horse station pile, 马步站桩, and practice the la qi. We do the la qi always. Uh, 所以说呢，我们中医有一句话叫做凡治之真，必显至神. So when do the treatment, we will concentrate mind to direct the qi from our lower dantian to middle dantian and going to the 3 meridians of hand in, and going to the palms and the fingers going to the needle, to the local treatment area. This is the qi treatment for that guy. He had very severe right ankle, the knee swelling and pain. So this is I taught the Qi needle downing therapy in the island 3 years ago. Yeah, this is in Paris. So a summary of the conduct of Qi needle downing therapy, they include the three elements. The first one is the Wei Qi, just the Wei Qi therapy. And Nei Qi, that means teach patients to do some special Qigong. And the third one is a new one, just recently or after COVID, I did the treatment with all around the world, the patients from America, from London, from the Canada, that we call 远距离视频足场调治 long distance 的足场发起 therapy online. So the first one is no contact when do the imitating Qi. Don't touch the patient's the point or the skin. And the second one is use the fingers instead of the acupuncture needle. Yeah, use the finger. And here is a Wuji Zhen, we just hold the, for example, here, the Yin Ling Quan, Yang Ling Quan, we just hold the needle, 2 minutes, 3 minutes. That is, we do the twist the needle firstly, and then concentrate mind to give the Qi to the points. And here is a Fu Zhen, Fu subcutaneous needle. I used the needle 20 years ago. Since 2001, started with founder Fu Zhonghua in Nanjing. Sorry, can't do again. Oof.
Doesn't matter. You can continue talk. Okay.
That is the Fu Zhen. Here I have some the case that this one is treat just use the Qi treat with the right side the sciatic pain. I just quick going. The second case that is for the frozen shoulder in 1995. That is case 3 with the Qi, just with the Qi, no needle, just the Qi for the leg scuff, the pain and weakness in Nanjing. That is I have played with you. The case 5 I have told. Okay, here I will use a few minutes to talk about this case. I played the video and talk about how to do. So first step is touch the loading Qi, and then tap guide Qi, and then no contact flat guiding Qi with palm. And then we do the this we call 平导 Qi, and then use the palm, use the circling, the no conduct screw guiding Qi with the palm along the bladder meridian. And this guy, he had a very severe pain between the right scapula and the spine, about 3 months. And this use the finger guide the salt fingers guiding Qi. And this one do this circling with the salt fingers. And this one is step 7, transfuse Qi with palm. Give the energy to the pain area. So this patient just after my 1 session treatment, because he recommended by another the acupuncturist. So when he come to see me, I think I need to use some special way to treat him, way to help to relieve the pain as soon as possible, because he is an acupuncture practitioner, but he's not Chinese. He can speak Chinese. So after 1 treatment, the pain disappeared, and a week later, another treatment.
好，我们现在检查一下。好，松软了很多，你自己的感觉怎么样？
现在感觉舒服。
好的。我这样压在这还痛吗？
不痛。
不痛了，好，非常好。这边已经比刚才 松软了非常多，基本上软了。好，非常好，这就是扶正加气功的歪气导引加扶正。
Yeah, this is the Fuzhen together with the external qi. I did a second time treatment to consolidate the effect. Since that time treatment to now, about over 3 months, he no pain around that area. He speaks very good Chinese and very good acupuncture technology. He studied in Shanghai University, ATCM. This case 7. In the winter of 2019, marathon runner who had pain on the upper middle side of the knee for 2 weeks came to the clinic and told me that a friend recommended that I could use qi needle to quickly relieve the pain, because he could only do 1 session treatment, and he would go to New York over 2 years ago to participate in the marathon. The next day, he told me that time. The patient disappeared after my 5 minutes of qi needle treatment. 10 days later, he called me and said, "Thank you very much, Dr. Shi. There has been no pain," which enabled him to finish the race smoothly. Okay, just a few seconds to look. So I still use the Fuzhen, a very special Fuzhen, to my right hand hold the Fuzhen, concentrate mind with the left the thought finger and the palm to transfer the qi, give the energy. This is the last case. The right shoulder patient guy, shoulder pain. He had very severe shoulder pain. First time I did the gentle needle treatment for him. Second time comes to me, he says still pain. So I say, okay. Second time I use just the Fuzhen together with the gentle needle. This treatment, this video, is made the third time treatment. So I think first, second time no any some help, but still pain there. So I think I will use the qi energy together with the gentle needle and the Fuzhen. So after that, the guy, he is very happy. He is very happy. So after that, he come to see me the fourth time. He said, "Dr. Xie, no pain that week." And I said, "Okay, if no pain, don't need to come to see me again."
Okay, try to move now.
He's a very hard fitness.
Actually, a bit aside.
How do you feel?
A little better.
A little better?
Yes.
Okay, great, brilliant. Okay, stop.
Okay, last just 1 2 minutes. I say the third one. The principle and the teaching extension of qi needle Daoyin therapy. When we pass some special qigong training, such as Shaolin inner strength, one finger meditation Zen, the genuine qi or vitality qi in our body will become very full. According to the principle that where the mind is focused, the qi will go. The genuine qi and the vitality qi in the body can be guided and mobilized to the palm and fingers under the action of the mind and act on some parts and acupoints of the patient through mental needles or fingers or space, so as to promote the movement of qi and blood and relief or eliminate pain. Traditional Chinese medicine says that the qi being the governor of blood, and the blood is the mother of the qi. The qi can promote the circulation of blood. Qi为血之血为气之母. If the qi, if qi is smooth, the circulation of blood will also be smooth. If the circulation of blood is smooth, the blood stasis will be melted, and the modules will be dispersed, and the mass will be disappeared. By practicing the Shaolin Qigong inner strength one finger meditation, then you can dredging your own meridians, enhance your own strength, and strengthening your body. We call 内导引 inner Qigong. Can also through a specific skill accumulate your qi with others by adjusting the field aura vibration can be formed with other resonance. Check the disease also can inspire others to their own blood, so as to realize qi, push the blood lines to achieve protein. Okay.
Sorry.
Okay.
Time.
Thank you. Okay. Very quick to finish few pictures. So last few years, I have taught the short energy interchanging all around the world in many countries. So if you are interested in the future, we have a chance to practice together. Welcome to contact. Thank you very much.
Okay. Many thanks for Dr. Xie for your interesting speech. That qi 密度领导引 my therapy. Very good, very interesting. So thank you very much.